Okay, this video is going to continue with the appendicular skeleton. We'll do the lower limbs. Your lower limbs, the girdle for the lower limbs is called the pelvic girdle and is made up of the os coxa or coxal bone. This is a very unique irregular shaped bone. This will sit where this is pointing toward the midline of the body. This is going to actually be where your butt would be. Okay? And over here we have this dent, and that dent is where the hip joint will go into, and the femur will go in there forming the hip joint. Okay. Now this is made up of 3 different bones when it fuses. The top bone is the ilium, okay, where my fingers are is where it kind of separates it, this flattened area. Okay, and this is going to be what you think of as your hip bone. Okay. Then we have this bone here, which you can cut it in half, look at your book. Back here, this is your ischium, and this bone in the front is your pubis. So you got your pubis, your ischium, and then the ilium on top. Okay. The large hole here made by the 3 different bones is the obturator foramen, and the hip socket is the acetabulum. Now, the ilium, we're going to separate the different bones. Your ilium, you have a number of terms on this. You need to know the top is called the crest, iliac crest. This smooth surface in the front is the auricular surface. Auricular sort of means ear-like. It looks like a giant elephant ear flap in here. Okay, that goes into this area also, which is also auricular, which will touch the sacrum, okay, and fuse with the sacrum. We have, I'm putting my hand here, this is the front of the anterior surface of the ilium, and it has 2 spines. They're both called anterior iliac spines, but they're designated anterior superior because at the top iliac spine, and the anterior inferior iliac spine. Okay. Then you move down to where my thumb is holding it, right here in the back, and this is called the greater sciatic notch. This is where the sciatic nerve will run through to exit from the spinal cord. We're going to move to your ischium, which is the bottom area down here, this area. Now your ischium has another spine on it. See that spine right there? It's right below the greater sciatic notch. Here's your ischial spine. Okay, it's on the other side of the iliac spines, right over here. And below the ischial spine is called the lesser sciatic notch. It's a little cutout because your sciatic nerve will separate into 2 different strands here. Okay. We go around here to the very bottom, and this is actually going to be part of your butt. It's like your bony butt when a kid sits on your, and it hurts. And this is called the ischial tuberosity. Ischial tuberosity, again, tuberosity is a bump. Okay, so on the ischium, you just have the greater sciatic notch. It comes down here, then we have the iliac spine, the lesser sciatic notch, and the ischial tuberosity. We go to the pubic side, okay, which is this pointed part right here in the front, which actually will sit like this on your body, so this will point more toward the medial line. And the pubis has, the top is the pubic crest. The bottom down here is called the inferior ramus, inferior is below, ramus. Okay. And then at the very end you have a tubercle, okay? So it's the pubic tubercle, another little bump here. Okay. This will attach to the other os coxa by that fibrocartilage pad, which will be right here in between the 2, and that is your pubic symphysis. Okay. The next bones of the lower limb, the upper leg, is the femur. This is the longest, largest bone in the body. This is the proximal end with the head, and this is the distal end. The proximal end has the head, and the head has a dent in it. It's really kind of hard to get these pictures good. There's a little dent. Look in your book, you can sort of see it right here, a little dent here, and this dent is called the fovea capitis, which means hole in head. Okay? And that fovea capitis is where one of the ligaments will attach to hold it in place in the acetabulum. Okay. You have also on the end near the head, you have some other large bumps. You have a large trochanter here and a smaller one down here. The top one is called the greater trochanter. Trochanters are only found in the femur. So you have the greater trochanter, the lesser trochanter, the bump down below, and the connection between the two is the intertrochanteric line or crust. Either term is fine. Now, we're going to turn it around, and this is the way it's going to face. This is the front, so that the ball can go into the socket of the acetabulum and attach to your body. Okay? On the back of this, we have a raised area back here, and this is where your gluteal maximus, your butt muscle, will attach. So there's another tuberosity here, the gluteal tuberosity. Again, it's another rough area. Okay. At the far end, we have the distal, and we have two condyles. Condyles, again, are articulations where two bones come together. Now, the head is pointing inward towards the body, so this is the medial side where the head is. This is the lateral side. So we have a medial condyle, this surface where the articulating cartilage will be, and a lateral condyle. Those condyles will form the joint of the knee. This is the tibia. They're going to sit like this together and form the joint of your knee right here. So we're going to move on to your tibia. We're done with our femur. We have the same two condyles. We have the lateral and the medial condyle. Now with the tibia, it also has a bump right in the very front here. Okay. This bump, I'm trying to get that angle, man. You can't really see it very well. The bump right here is called the tibial tuberosity, and this is where your patellar ligament is going to attach. You can feel it in the front. Your tibia is also known as your shin bone. At the far end, there is another process, much bigger than a styloid process. This is called a malleolus. This is on the medial side, so it's the medial malleolus. Okay. When we take the fibula and put that to the lateral side, fibula has L in it and has a lateral has L. It has its own malleolus. This is the lateral malleolus. And these two will go right on top of the ankle bones to kind of hold them in place. Okay. Your fibula has the lateral malleolus, and at the other end is called the head. The head is a little more cube-shaped, a little fatter than the flattened end. Okay. So you can tell the difference between those two. Okay. We have the patella. The patella is your kneecap. It is going to go, the back of it's called the facet or face of the patella. It's going to go between the femur and the tibia. And then we have the bones of the foot. Now your foot's not as complicated as your wrist. It does have the same metatarsals here that make up what you think of as your foot. Okay? Tarsals start with T, toes start with T. The wrist, the hand, it was carpals in this area, so these are tarsals. It's got phalanges named the same way, okay, by the three bones. It's the proximal, middle, and distal, except for the big toe that has only proximal and distal. And your phalanges in both hands and feet are counted in number. So this is number 1, 2, 3. The littlest one is number 5. So if I asked you to identify this structure, I might be looking for a phalange 1 or metacarpal 1, 2, 3, 4, 5. So you have to get the right number also. Now the bones of the ankle. Your ankle is pretty clunky, and your foot does look like this. Many people think it should go the other way. You have a nice arch here. This big, large bone back here makes up your heel. This is your calcaneus. And on top of the calcaneus is the trochlear, which is a pretty big bone right here. In front of the trochlear is the navicular. Okay. And then in front of the calcaneus on the side is a cube-shaped structure. That is your cuboid. And then we have 3 bones at the base of the toes, the base of the metatarsals. And those 3 bones are all called cuneiform bones. Since this is the medial side, because it's got your big toe here, it's going to be the medial cuneiform, the intermediate cuneiform, and then the lateral cuneiform. Okay, like intermediate school, you went to intermediate school, it was middle school, so your medial, middle, or intermediate, and lateral. Okay.